In this short video presentation, we're going to talk about types of questions and how to look at a question to help you come to an answer if you don't know the answer. So some of the things you need to know about test questions, there are different levels of test questions, and that's based on Bloom's taxonomy. The first one being knowledge-based. And if you have a knowledge-based test question, it is usually pretty easy. It's based on your memory. And an example of that would be potassium. What is the potassium level? Of a lab value. So you need to memorize those types of answers. As you grow in your nursing education, the questions do become more difficult. And at the top of the level is application and synthesis. And in this level, you would be given a case study and you would need to come to a conclusion. So as you progress in your nursing education, you're going to find that the level of questions will become harder, and it will be based, you have to use your knowledge base to come to the answer. The other types of questions you may run into are the nursing process. And the nursing process are questions based on the nursing process. So if you have a question that is asking about your assessment, the answer needs to usually relate to your assessment. And I will be giving you examples of these a little bit later. If it's a question related to intervention, your answer would need to be an intervention. Finally, the test questions are based on the NCLEX blueprint, and one of these sections is client's needs. And you can go and you'll find this in most of any of your textbooks. You can look online for the NCLEX blueprint. It talks about where these types of questions fall. I would not get too caught up in that, but just be aware that there's different types of questions that fall into different categories. So the client need question, which is NCLEX related, is based on health promotion and maintenance, a physical versus psychological, and a safe care environment. And the thing I want to point out in these types of questions is that if you have a question that's based on a physical need, the answer really needs to be related to a physical need. Whereas if it's a psychosocial need, the answer will have to be related to a psychosocial need. And I will give you an example in a few minutes. So some of the things you need to know that are basic test taking strategies is to remain calm during the test, which is not always easy to do. We talked about taking deep breaths, making sure you read the question carefully so you are answering the question that is being asked. And many times it is easy as a nursing student to add your thoughts to the question and think of a situation, and then when you start doing that, it will change your answer. So make sure you are going through and reading the words of the question and answering what that question is asking. Have confidence in your first response. Research shows that your first response is usually correct. So unless you are 100% sure that that was wrong, you should not change your answer. Continue to maintain that positive attitude during the test, and I'm going to show you ways not to have to avoid guessing. So some basic test taking strategies are many times the longest answer is the correct one. I wouldn't use that, but it is a ratio, and I think that is correct. Avoid looking for a pattern code when you're taking a test. So that means if you've gone through the test and you think you've answered B too many times or a certain number too many times, the whole test could be B. So don't look for any type of pattern code that really has nothing to do with answering any questions. Look for grammatical inconsistencies. So I will give you an example of this, but it's looking at how is the sentence set up. Could you answer the question based on grammar? And I will show you that so it makes more sense. This one's vague. Look for options that are similar. Many times, if it's a multiple choice question, 3 of the 4 options are incorrect, and the other one is correct. And it is amazing how many times you can use this, because if you learn to get really good at this, you'll be able to group your distractors. Look for incorrect and correct options, and make sure that you're looking at what is really being asked. If you are being asked about a patient, make sure your answer is patient related, versus if you're being asked about nursing, make sure it's nursing related. Another thing is you can sometimes find information in the stem of the question. An example of this would be you're being asked about a calcium supplement used for osteoporosis, and your answers could be Lasix, Rifaximin, calcitonin, and aspirin. And you don't have a clue what the answer is, but because there's calcium in the stem of your question and calcitonin in the bottom, you can make an educated guess looking at those similarities. Be aware of information from previous questions. Did you answer something earlier that's going to help you answer this one? And again, I can't tell you enough to read the answer carefully. Sometimes it's a small word such as not, or priority, or something that you missed, and that one word can make the difference in the answer. So carefully read your question. Sometimes it's nice to make a mental highlight of what it's really asking, coloring out key words if you have a highlighter. If you want to practice this, you can do it with questions at the end of your textbooks, and practice test-taking strategies by taking a highlighter, looking at the question, highlighting what you think is important, and then looking at the answers and see if you can match that up. So you're going to base your answering test questions on your knowledge, your clinical skills, and your test-taking strategies. And with that, you should be hopefully able to be successful. One of the situations that sometimes you often come into is you get it down to 2 answers. That's not unusual. But what best way to do that then is go back and read the question again very carefully, see if you can find something in the stem that relates to one of the 2 answers instead of guessing. Keywords are what focus your attention, and I will show you then in the next couple slides how you can highlight either physically with a highlighter or mentally the keywords, and that helps you key what is important in the question. What are we really asking? Is it the client? And I talked a little bit about it. It doesn't always have to be the client. It could be a situation. So make sure that you identify what the question is asking. Is it an issue? And a good example of this is, are they asking for side effects or contraindications? 2 very different things. So make sure when you are reading questions, you are reading it very carefully. True or false questions are usually related in this fashion, so most appropriate to pass. These would be false responses, least likely lowest. And those again help you kind of zone in for what is important. These are keywords that help you answer the question, usually related to ABCs. Many nursing questions are related to airway, breathing, circulation. So you're going to treat that before you do anything else. So if you see a word vital, priority, what are you going to do first? Think about airway, breathing, circulation first, and if it's appropriate, your answer may be related to that. So this is a practice question using test-taking strategies. I'm not going to read this because it is actually sort of a tongue twister, but I want to demonstrate to you a test-taking strategy. And if you look at the stem of this question, is there an answer that you could pick from here that would make sense? And that answer, if I'm going to use test-taking strategies, is A, because A is similar to this word in here. Same thing as calcium, calcitonin. I'm connecting something that relates. This relates to grammatical inconsistencies, and in this case, which you probably won't see anymore, it's AN/A, but because the answer needs to start with a vowel, you would pick that answer. But it's again, a way to have you zero in on the grammar that's in the test question. This talks about absolute words. So here's the stem of your question. This time I want you to look at the answers, and 3 of these answers have absolute words. Absolute words are like all, always, or no. This one says usually. So these are similar, so I'm going to pick that one, and it is a correct answer. If the question asks for 2 things or 2 or more things, reasons, then there has to be 2 or more things down here. And if you look at your 4 answers here, the only one that has 2 answers in it is number 1. So I'm going to pick this one because there are 2 answers where the other ones only have 1. This test question is based on previous information, believe it or not. We already talked about the IGNOU, remember? We talked about the IGNOU in question 2. So if I have to take an educated guess, I'm going to tie that to the fribbled bread. And that is because I don't know the answer, but that's a way to come to an answer. So now I'm going to go over a few questions that are nursing related. I'm going to try to show to you how you can answer these questions or what you can look at. So in this question, a patient is being prepared for sealed internal radiation for cervical cancer. The stem of the question is this. The nurse can help reduce the patient's anxiety by emphasizing that. So what are we looking at here? We're trying to reduce the patient's anxiety. So that's a psychosocial question. You need to come up with a psychosocial answer. And if you look at your selection here, pain medication will not decrease anxiety. It will decrease a physical need or decrease pain. This will not decrease anxiety. The nurse will be available. Could be an answer. The patient, if you know anything about radiation, the patient would be reactive, so that would be based on your knowledge base. So based on that, I need to meet a patient's psychosocial need by having the nurse available. This one is an example of a knowledge-based question. You just would need to know that HIPAA guidelines preserve the patient's right to, and we all know what it is, and that is to maintain privacy. So it's a basic question. Here's an example of an assessment question. The nurse is assessing the patient's circulatory status by checking all the peripheral pulses. She is using the technique, and these are the different techniques. This is a pretty easy question, but let's pick out the key words. Peripheral pulses, assessing peripheral pulses. We know the answer has to be palpitation. However, if I change this one word to apical pulse, that changes the answer to auscultation. So again, easy question, but you have to look at these key words. Here is an example of reading. I'll show you how to read all these words and come up with an answer. A nurse overhears a terminally ill patient with cancer state to his families. If I get over this cancer, I will travel with the church next spring. What stage of dying is a person in? So here are the stages of grieving, or as it's stated here, is dying, but it really should be grieving. Keywords, if I get over. Patient, knowing the patient says has cancer. It doesn't sound as if there's any anger in this statement. So no anger, they're not denying it. There's no evidence of depression, but they're bargaining because the keywords are if I get over. And that would be how you would come to that conclusion. Here's an example of a question that you may not know the correct answer, but there are 3 answers that you can say are alike. So it's talking about a patient with metastatic cancer. He or she is receiving morphine sulfate. The nurse monitors the client for which adverse or toxic effects. Key words here, adverse or toxic. We're not talking about side effects here. We're talking about adverse or toxic. We know that dizziness, sedation, and nausea are side effects. So even though I may not have studied this, it's also the longest answer, but um, these we know are wrong. So I have to answer that because that is the correct answer. Sometimes you are very uncomfortable putting an answer down if you don't really know, but if you know the other three are wrong, then you need to pick that as the correct answer. This is an example of an assessment question. A nurse is assessing and caring for a patient who has just returned from PACU after undergoing surgery. The priority keywords are the nurse monitors for early signs of hypovolemic shock. So there's many signs of hypovolemic shock, but what is the earliest sign? So you have increased pulse, increased depth of respiration, lethargy, and increased orientation. You know that when there's hypovolemic, low volume shock, your heart needs to work harder to get the volume around. So the first thing that's going to happen is the pulse rate goes up. The other ones, these two eventually can occur, but are not the first thing to happen, and this is just actually a wrong answer. These are examples of common keywords that you use to prioritize, and like I said, ABC is a big one, airway, breathing, circulation. Many times can be the right answer, not always, but they can be. Here's an example of ABCs. The client with a diagnosis of cancer is receiving morphine sulfate, 10 milligrams sub-Q every 3 to 4 hours for pain. When assisting and planning care for the client, the nurse includes which priority action? You look at the answers, 3 are all alike. I'll give you a minute just to take a look and see if you can decide which 3 look alike. So if you look at 1, 2, and 4, they're all about intake and output. 3 relates to coughing and deep breathing. That's different than the other 3. So there's a test-taking strategy there. It's ABCs. It's the longest answer. So there's a couple different ways to come to that answer if you didn't know how to answer it. This one is a nursing process data collection. So the nurse is caring for a patient with COPD who complains of dyspnea. The client is on oxygen at 2 liters per minute with a respiratory rate of 22. The nurse should take which action first? Again, priority setting. So if you look at 3 of these answers, they're interventions. 1 is an assessment, and this one is an intervention, increase the flow rate, contact. You would never tell a patient not to worry, but they're all interventions. You don't really know what's going on here. Respiratory rate is not that high. So the first thing you're going to do is continue your assessment. You do not have enough assessment data to do any of these other things. I'm going to go to this one. So this one is about a patient with eclampsia. The nurse understands that if a client progresses from preeclampsia to eclampsia, the first action is, okay, priority setting. I may not know anything about eclampsia. It's increased blood pressure, edema, with multiple other side effects with a pregnant mother. If you look at 3 of these answers, they are somewhat similar, and this does take practice. But if you look at 2, 3, and 4, they all relate to airway, breathing, circulation. So in this case, that isn't the priority, and the correct answer is to give mixed sulfate. But again, if you didn't know that, you could look at these 3 and say, wait, these all are somewhat doing the same thing. This one's totally different. And we'll do this one. This is about LPN is assigned to care for a group of patients. On review of the client's medical records, the nurse determines that which client is at risk for excess fluid. Okay, key word here, excess fluid. Want to highlight that in your head, circle it. 3 of these, the patient is losing fluid. So I'll give you a short time to just take a look at each one of these and think about which ones are losing fluid. And if you read them again, you'll realize that 1, 2, and 3, the patient is actually losing fluid from their body in some form. And the correct answer is the client is in renal failure, so they would be retaining fluid. But these 3 are similar in that the patient is all losing fluid. This is an example of absolute words where we have an absolute word in 3 of the 4 stems. So the nurse determines that the client understands the instructions when the client states which of the following. If you notice that in 1, 3, and 4, the word must. I must not allow, I must wash my nipples, I must keep my clothes. So if you didn't know the answer, a test-taking strategy would be to use the question that does not have an absolute word, and that one would be number 2. So that basically is a short overview of test-taking strategies. It takes time. There are books on it. I highly recommend that you learn how to use test-taking strategies in your classes. You can do really well. It is a good tool to have in addition to your knowledge base. If you buy an NCLEX review book, such as Saunders, those books have a chapter in the beginning on test-taking strategies and just questions that you can also practice. So it's just a good idea to do. I wish you well, and hopefully this has been a good learning experience. You might want to keep this for future reference when you get further along in your nursing education.